Honorable Ministers, distinguished ladies and gentlemen, I'm pleased to be here today to join this important discussion. The African Union Agenda 2063, the Africa we want, is the continent's flagship strategy and blueprint towards sustainable development and a prosperous Africa. In 2019, African leaders met to discuss health and their commitment to pursue human capital development as a basis for Africa's economic growth and recommitted to increase investments in health and improve efficiency. This demonstrates the centrality of healthcare in realizing the future for Africa that we all aspire towards. For more than 2 decades, Gavi has supported this effort, its alliance partnership with 40 AU member states reflecting both the pride and progress in what has so far been achieved. The ongoing collaboration has enabled us to reach more than 364 million children in Africa with life-saving vaccines, preventing more than 8.9 million deaths. Strengthening primary health care through expanded immunization has been one of Gavi's priorities in contributing to this and a more prosperous Africa. None of this would have been possible without an investment in health, not just the about 9.7 billion US dollars that Gavi has distributed in Africa, but critically also the more than 688 million African governments have themselves contributed. Increasing equitable and sustainable access to vaccines doesn't just save lives and protect people from infectious disease. Its broader health impacts are pivotal, particularly now since COVID. As the only intervention that brings the majority of households into contact with the health system 5 or more times during the first year of a child's life, it has a key role to play in strengthening primary health care. That is why it is so important for countries to continue to introduce and scale up coverage of vaccines for the prevention of both endemic and epidemic disease, and why the prioritization of vaccines most appropriate for their individual context and resources is so critical. Now, prior to the pandemic, Gavi's unique co-financing model played a key role in increasing country ownership and national investments in immunization. Moreover, this had been gathering momentum, with the average amount paid per year in co-financing increasing substantially between our last 2 strategic periods, from $86 million to $131 million. And despite the pandemic, we've seen countries maintain this strong commitment by contributing $129 million in 2020. But now increasing equity will require a shift in focus to reach the 10 million children and families in Gavi-supported countries that have not received a single shot of a basic vaccine, the zero-dose children. Strengthening sustainable domestic public financing will be key to achieving this. Therefore, the immediate priority must be to gradually enhance country contributions and ownership of vaccine finance and service delivery financing with a view to reduce the number of zero-dose and under-immunized children. Reaching zero-dose children is one of the most direct, equitable, and achievable approaches to achieve the ambitions of universal health coverage and the African Union Agenda 2063, and why it will be a priority for Gavi's health system strengthening support in the next strategic period. By ensuring that effective and efficient immunization services are integrated into health systems, we can create stronger, more resilient and sustainable primary health care and realize the ambitions of the African Union Agenda 2063 and the SDGs. Domestic investment in health is a prerequisite for all of this to happen. That means recognizing that inclusive growth is dependent on a healthy population, and that the most effective path to universal health coverage is through strong primary health care systems. This will be critical to helping national leaders achieve economic and development goals. Gavi and its Vaccine Alliance partners look forward to continued collaborations with all of you. Thank you for your attention.